Bismillahirrahmanirrahim. Occupational safety and health is vital to the dignity of work. And today my topic of presentation is ergonomics and setting up of occupational health services. Learning outline of my presentation is introduction of ergonomics, dimension of ergonomics, risk factor and solution, basic occupational health services, recent update, and at the end, MCQ session. At the end of this presentation, participants will be able to describe the ergonomics, their dimension, risk factor, solution, and recent updates. Ergonomics, the scientific discipline concerned with understanding of interaction among humans and other elements of a system, and the profession that applies theory, principle, methods, and data to design in order to optimize human well-being and overall system performance. Ergonomics means fitting the job to the worker, and for this purpose, we include proper workstation, proper tools and equipments that require for a good job. There are three dimensions of ergonomics: physical ergonomics, cognitive ergonomics, and organizational ergonomics. First, we know about physical ergonomics. It is mainly physiological interaction of people and their activities that are concerned. Improvements are sought in the fields of posture, body manipulation, carrying heavy weights, movement, the configuration of workstation, safety procedure, and health in general. Now, cognitive ergonomics. Cognitive ergonomics deals with the mental aspects of operator, activity, relationship, perception, reasoning, memory, stimuli, and psychomotor response. The improvement in this department related with cognitive ergonomics have to do with performance issue, decision making, management, mistakes, or stress condition of the workers. Organizational ergonomics. This type of ergonomics focus primarily on the structural issue of professional system, organization of processes, and operational regulation. Its privileged contacts are human resource managers. They work in particular on issues related to timetables, working rhythm, modalities of activities. There are different types of injuries which are related when the proper ergonomics rules are not followed in any occupational in any occupation. Overexertion leading to cause of injuries, it is most costly because when worker is injured, there are different penalties which are coming to the administration department. Recurrent and persistent pain may develop in future. Bodily reaction is another leading cause of injury in workplace. Repetitive motion also with top 10 most common workplace injuries. And there are a major injuries which are involved in occupation are musculoskeletal disorder. Almost 33% of the worker suffering from musculoskeletal disorder. It affects the muscle, nerve, blood vessel, ligaments, and tendon. And the symptoms that are faced in the musculoskeletal disorders are discomfort, pain, numbness, loss of motion, flexibility, spasticity, and stiff joints. There are different musculoskeletal disorder, and the most common are carpal tunnel syndrome, tennis elbow, bursitis, ischemia, sciatica, herniated disc, neck strain, disability, and tendinitis. And the affected areas, most common affected areas are back, arms, elbow, shoulders, neck, hand, wrist, and fingers, knees, ankle, and feet. These are the most common areas which are affected in musculoskeletal disorders. There are different risk factors which are occur that's why the musculoskeletal disorders are occurring, and it depends upon work position and posture of a worker, how often task is performed, level of required effort, and duration of task. These are some risk factors. There are different methods of prevention these musculoskeletal disorders. Establish ergonomics program, training of the worker, feedback from all level of uh, the organization, conduct job hazard analysis, early recognition and reporting of potential musculoskeletal disorders. There are some examples of engineering control. The proper buildup of workstation, which are properly designed and set up, ergonomically designed tools, which are used by the workers, ergonomically designed equipment, and the load weight reduction by the help of different equipments and tools. Example of proper work practices: proper lifting techniques, team lift heavy bulk and awkward loads, stretch, work rotation, task variety, and increase rest break. And the proper personal protective equipments are used by the worker when they are working, like gripping gloves, knee pads, vibration gloves, thermal gloves, lifting straps, shoulder harness, and lifting braces. There are different hazards which are faced by the workers in any occupation, and ergonomically designed solution of these hazards are very much necessary. Reaching above the head and shoulders, if your arms are reaching above the head and shoulders during work, working with the hands above head for more than 2 hours per day, working with the elbows above shoulder for more than 2 hours per day, then there is a physical hazard which are faced by the workers. And the solution of this for the prevention of this hazard: keep items within close reach, elevate work areas, remove obstacles, utilize equipments to raise and lower items or move item closer to the worker. And when you work in awkward body posture, then there is also uh, great chance of musculoskeletal disorders, like working with the neck or back bent forward more than 30 degrees for more than 2 hours per day, and when you are work in a squatting position for more than 2 hours per day, and kneeling for more than 2 hours per day. There are many occupation in which these positions are adapted by the worker for many hours, and then there is a greater chance of musculoskeletal disorder. Solution is raise or tilt the work for better access, use a stool for ground level work, use tools with longer handles, alternate between bending, kneeling, sitting, and squatting position. There are many occupation in which the workers grip the many products for more than 2 hours. Gripping 10 or more pounds or force for 2 or more hours per day, then there is a chance of injuries. And the solution is design work layout to reduce hand carrying work, reduce amount of items carried at one time, use non-pinch grip posture, use ergonomically designed tool and aids, use job and task rotation, alternate your hand if there is a lot of repetitive motion, repeating same motion for more than 2 hours per day with hand, wrist, elbow, shoulders, or neck, then there is also a chance of injuries. And the solution of this is arrange work to avoid unnecessary motion, let power tools and machinery to do work, spread repetitive workout during the day, take stretch pauses, rotate tasks with other co-workers if it is possible, change hands or motion frequently. When you are lifting heavy, frequent and load, then there is also chance of injuries, and the solution is proper plan the lifting activities, minimize lifting distance, position materials to power zone level, avoid manual lifting, lowering loads from floor, identify and reduce unstable or heavy loads, reduce frequency of lifting and duration of lifting task, provide clear access while lifting. Now it's come to the occupational health services. The basic occupational health services are an application of the primary healthcare principle in the sector of occupational health. Primary healthcare definition can be found in the World Health Organization Alma Ata Declaration from the year 1978 as essential healthcare based on practical, scientifically sound and socially accepted method. It is the first level of contact of individual, the family and community with the national health system, bringing healthcare as close as possible to where people live and work. An effort was launched by the International Commission on Occupational Health to develop basic occupational health services, which are required almost all workers. Occupational health services are available to only 10 to 15% of workers worldwide. There is a proper surveillance of work environment and risk assessment. This is the need of basic occupational health services. The surveillance of the work environment is one of the key activity of basic occupational health services, and there are different surveillance and the risk assessment can be carried with the help of surveillance. Ergonomic factors which might affect health workers, condition of occupational hygiene and factors such as physical, chemical, biological exposure which may generate risk to the health of workers, exposure of workers to adverse psychological factor and aspects of work organization, risk of occupational accident and major hazards, collective and personal protective equipments, control system designed to eliminate, prevent, or reduce exposure. These are the risk assessment which are carried with the help of surveillance. Health examination is the basic need in the basic occupational health services. Pre-assignment and pre-employment health examination is necessary. Periodic health examination, return to work health examination, journal health examination, and health examination at termination or after ending of services. First aid and participation in emergency preparedness. Providing first aid services at the workplace when appropriate, introducing and training first aid practices to worker and supervisor, maintaining and periodically inspecting the first aid readiness and facilities, participating from the health point of view in emergency planning and organizing the health elements in emergency response. Diagnosis of occupational disease is the most important in basic occupational health services. You must identify of exposure which may cause the disease, examination of clinical findings which are known to be associated with the specific exposure, exclusion of non-occupational factor as a possible cause of disease, statement on occupational disease for workers' compensation, proposal for preventive action to the workplace of the worker in concern, and notification of occupational disease to the authorities. Record keeping is also most important basic occupational health services. Journal health record if the worker are treated as patient or health service clients. Data on surveyed, detecting and measured occupational exposures and risk assessment which have been made. Statistic on occupational disease and injuries. Data on health examination and documents on proposal for preventive and control measures. Now it's time for recent updates. There are different laws at national level for the better occupational health. The Mine Acts 1923, the Factories Act 1934, Boilers Act 1923, Explosives Act 1884, Petroleum Act 1934, the Dock Laborer Acts 1934, the Workmen Compensation Act 1923, the Boilers and Pressure Vessel Ordinance 2002, Punjab Labour Policy 2015, and Pakistan Occupational and Safety Act 2018. These are different laws which are passed in Pakistan in previous year, and the most recent is Pakistan Occupational and Safety Act 2018. An act to ensure safe and healthy working conditions for the people at work by authorizing enforcement of the rules and regulation developed under the act by assisting and encouraging the organization, institution, and geographic areas governed by the federal government in their efforts to ensure healthy and safe working conditions by providing for research, information, education, and training in the field of occupational health and safety. These are the basic aim of Pakistan Occupational Health and Safety Act 2018. There are some international acts in which OSHA Acts and Global Plan of Action on Workers' Health 2008-2017. This plan links occupational health to public health by identifying the following objectives for global action: to devise and implement policy instruments on worker health, to protect health workers, to improve the performance of and access to occupational health services, to provide and communicate evidence for action and practices, to incorporate worker health into other policies. This is one of article in which the impact of ergonomics on children studying online during COVID-19 lockdown. And the result of this article shown that children spent longer hours on gadget, on laptop almost 58%, Android phones 28%, desktop 12%, and tablets almost 10%. The content which are seen by the children on gadgets was 45% curriculum, 35% games, and 20% other content. Study revealed that parents were unaware of ergonomics and effect on their children. Very few parents understood the correct sitting posture during the gadget use, eye monitor ergonomics, and laptop ergonomics. About 21% of subjects suffered from upper back pain, 18% lower back pain, 13% eye strain, 11% headache, and 6% had irregular sleep, and 6% suffered from behavioral changes. Effects of wrong posture during work, repetition, loading, and probable cause for pain were discussed in this article. Now it's time for MCQs. Pre-placement examination ensure that your prospective employee can safely perform the job they are applying for. One of the statement about pre-placement medical examination is not true. It is done to assess the fitness of a person for specific job, conducting only on those who are concerned with public safety, used for record keeping, gives baseline information of health.
B.
B.
B is the right answer because all other statements are included in pre-placement examination. Global plan of action were whose mandate is to advance social and economic justice through setting international labor standard. The main objective of global plan of action about occupational health is promotion of well-being, protection of worker, placing of worker at appropriate place, providing treatment to worker.
B. Protection of workers.
B, protection of worker is a correct answer. Worldwide, there are many type of accident related to occupational health hazard. Most common type of injuries related to occupational hazards: musculoskeletal injuries, burn, fractures, or cancer.
A.
Musculoskeletal injuries, 33% ratio of is musculoskeletal injuries during occupational hazards. In XYZ factory, there is proper design and setup of ergonomically designed tool. Which type of control method is used in this factory? Engineering control, personal protective equipment, administrative control, or proper training of the worker.
A.
Engineering control, A, is the right answer because all tools which are used in the factory are properly designed and set according to rules. A man work in workshop in kneeling position more than 2 hours and he complain of pain in knee joint. Which type of personal protective equipment recommend for this person? Thermal gloves, knee pad, vibrating gloves, or lifting straps?
B.
B is the right answer. In some area of factory, there is use of repetitive motion for completion of task. Administration design that work ergonomically. Which type of plan cannot meet that task? Change hand motion frequently. Use machinery to do work. Use personal protective equipment. Rotate task to co-workers. Repetitive motion is used for completion of task. C is the right answer. Used personal protective equipments. In the context of occupational environment, the discipline which is used for fitting the job to the worker is commonly known as ergonomics, ergometrics, pre-placement, or biometrics.
A.
A.
Ergonomics, A, is the correct answer. The dimension of ergonomics which deal with performance issue, decision making, or stress related problem of worker. This statement comes in which domain? Physical ergonomics, cognitive ergonomics, organizational ergonomics, or occupational ergonomics?
B.
B, cognitive ergonomics. Dimension of ergonomics which privilege contacts are human resource manager and issues related to timetable, working rhythm, modalities of activity are sought out. Which type of dimension is physical ergonomics, cognitive ergonomics, organizational ergonomics, or occupational ergonomics?
C.
Organizational.
C, organizational ergonomics. Medical examination is necessary for workers. Which examination ensure that your prospective employee can safely perform the job they are applying for? Periodic examination, pre-placement examination, examination at termination, journal health examination.
B.
B, pre-placement examination. E of my MCQs, references, and thank you.